Welcome to this promotional video sponsored by AstraZeneca. Hello, my name is Dr. Panettiere and I'm Vice Chancellor for Translational Medicine and Science, Professor of Medicine at the Robert Wood Johnson Medical School in New Brunswick, New Jersey, and a practicing pulmonologist. I'm here to talk to you about how FASENRA, benralizumab, may help your patients with severe asthma reduce exposure to oral corticosteroids.
FASENRA is indicated for the add-on maintenance treatment of patients with severe asthma aged 6 years and older and with an eosinophilic phenotype. FASENRA is not indicated for the relief of acute bronchospasm or status asthmaticus. The treatment of adult patients with eosinophilic granulomatosis with polyangiitis, EGPA.
Please watch this complete video for additional important safety information. When severe asthma becomes uncontrolled and patients experience exacerbations, short or long-term courses of oral corticosteroids, OCS, are often used. Every milligram of OCS counts. Even short bursts of OCS can add up quickly and may lead to significant side effects. My goal is to help patients maintain their asthma control and avoid OCS as much as possible. In the Zonda trial that studied patients on daily maintenance OCS, FASENRA helped patients reduce their median daily OCS dose by 75% versus a 25% reduction with placebo while maintaining asthma control. Additionally, the Ponente trial was a large phase 3b open-label single-arm study in OCS-dependent patients that was designed to measure FASENRA's safety and efficacy to help patients eliminate or reduce their daily OCS usage. The primary endpoints were the percentage of patients achieving 100% reduction in daily OCS dosage maintained for greater than and equal to 4 weeks without worsening of asthma control, 100% reduction in daily OCS dosage, or a daily dosage of less than or equal to 5 milligrams if adrenal insufficiency prevented further reduction, maintained for greater than or equal to 4 weeks without worsening of asthma control. Results demonstrated that FASENRA helped 63% of patients come off daily OCS treatment while maintaining asthma control. 91% of these patients achieved a daily OCS dose of less than or equal to 5 milligrams. Moreover, OCS-dependent patients maintained consistent OCS reductions regardless of their baseline blood eosinophil counts. Results are descriptive only. Before we wrap up, let's review the important safety information for FASENRA.
FASENRA, benralizumab, important safety information. Contraindications. Known hypersensitivity to benralizumab or excipients. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, for example, anaphylaxis, angioedema, urticaria, rash, have occurred after administration of FASENRA. These reactions generally occur within hours of administration, but in some instances have a delayed onset, i.e. days. Discontinue in the event of a hypersensitivity reaction. Acute asthma symptoms or deteriorating disease. FASENRA should not be used to treat acute asthma symptoms, acute exacerbations, or acute bronchospasm. Reduction of corticosteroid dosage. Do not discontinue systemic or inhaled corticosteroids abruptly upon initiation of therapy with FASENRA. Reductions in corticosteroid dose, if appropriate, should be gradual and performed under the direct supervision of a physician. Reduction in corticosteroid dose may be associated with systemic withdrawal symptoms and/or unmask conditions previously suppressed by systemic corticosteroid therapy. Parasitic helminth infection. It is unknown if FASENRA will influence a patient's response against helminth infections. Treat patients with pre-existing helminth infections before initiating therapy with FASENRA. If patients become infected while receiving FASENRA and do not respond to anti-helminth treatment, discontinue FASENRA until infection resolves. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 5%, include headache and pharyngitis. Injection site reactions. For example, pain, erythema, pruritus, papule, occurred at a rate of 2.2% in patients treated with FASENRA compared with 1.9% in patients treated with placebo. Use in specific populations. The data on pregnancy exposure from the clinical trials are insufficient to inform on drug-associated risk. Monoclonal antibodies such as benralizumab are transported across the placenta during the third trimester of pregnancy. Therefore, potential effects on a fetus are likely to be greater during the third trimester of pregnancy. Please read full prescribing information, including patient information, at FASENRAHCP.com.
Is reliance on OCS a problem for your patients? Consider FASENRA. Thank you for watching.